Welcome back to the ProPA podcast. I'm your host, Prof. G, and this is another installment of the MSK101 series, your go-to source for mastering musculoskeletal disorders for the PANCE and clinical practice. In this episode, we're tackling a high-yield but often overlooked condition, Paget Disease of Bone. In this clinical medicine brief, we'll walk through the key features, diagnostic clues, and treatment strategies that you need to know. Let's dive in. Did you know that Paget disease is the second most common bone disorder after osteoporosis in people over 55? It often goes undiagnosed because it's asymptomatic in many cases, but when it does cause symptoms, the bone pain and deformities are hard to miss. So first let's look at the kinder patho. What is Paget disease? Well, Paget disease is a disorder of bone remodeling. It starts with excessive osteoclastic bone reabsorption, and it's followed by a disorganized and compensatory increase in osteoblastic bone formation. The result? Enlarged, deformed, and structurally weak bones. Most commonly, this affects the pelvis, the skull, the spine, and long bones of the legs. It's often focal rather than systemic, and it can lead to complications like fractures, hearing loss, and arthritis. So, what is the typical clinical presentation? Well, many patients, like we mentioned, are asymptomatic and diagnosed incidentally via labs or via imaging. When symptoms are present, we often see bone pain, which is the most common symptom. We can also see bowing of the legs, enlargement of the skull, and we might not a patient might not come in and say, my skull's enlarged. They might say that their hat size has increased. They also might note some hearing loss, especially if the skull is involved because of the compression of cranial nerve 8. You can also get pathologic fractures, which are fractures not caused by significant trauma, and increased warmth over the affected areas, and this is due to the hypervascularity. So, how do we diagnose and work up Paget disease? Well, so typically we start with lab work, and what we're looking for is an isolated elevated ALK phos or ALP, and in the context of a normal calcium phosphate and PTH. On imaging, x rays generally show lytic lesions in early disease and sclerotic thickened bone in the later stages. We might also see a cotton wool appearance of the skull. A bone scan is usually used to assess the extent of the disease. So, how do we treat Paget disease? Well, generally we start with bisphosphonates like alendronate or zoledronic acid, and this inhibits osteoclastic activity and it normalizes ALK phos and relieves some of the symptoms that they have. We used to use calcitonin, but we rarely use that now. And we also have to consider pain management and physical therapy for the supportive care. All right, let's look at book med versus street med. So, book med, we're going to see an older adult with isolated elevated ALK phos, bone pain, abnormal x rays, and this is classic for Paget disease. We're going to treat with bisphosphonates. Now, the street med, most patients are found incidentally during workup for something else, like an elevated ALK phos on routine labs or imaging for unrelated symptoms. Keep this one in your back pocket when you see a high ALK phos in the absence of liver disease. All right, now some quick clinical pearls. Think Paget disease in older adults with elevated ALK phos and normal calcium and phosphorus. If you see skull involvement, think about hearing loss. And think about the cotton wool skull, which is a finding on the x ray classic in board exams. Treat with bisphosphonates to control the disease activity, and bone scan helps determine the extent, but not the diagnosis. All right, now it's time for some practice questions. So, question one, a 72-year-old man is found to have an elevated ALK phos during routine labs. He denies pain or recent trauma. An x ray of the pelvis shows thickened trabeculae and cortical bone. What is the most likely diagnosis? Is it A, osteomalacia, B, osteoporosis, C, Paget disease of bone, or D, multiple myeloma? I'll give you a few seconds. Well, this one wasn't too tough. The answer is C, Paget disease of bone. This is a classic incidental finding with X-ray changes in isolated alk phos. All right, question 2. Which of the following is the most appropriate first-line treatment for symptomatic Paget disease of bone? Is it A, vitamin D supplementation, B, bisphosphonates, C, NSAIDs only, or D, calcitonin nasal spray? I'll give you a few seconds. If you said B, bisphosphonates, you're correct. These medications inhibit osteoclastic activity and are the mainstay of treatment. All right, so some quick final thoughts. Paget disease may be easy to miss in the clinic, but it's a favorite on exams. Keep it in mind when you see an older patient with an elevated alk phos and bony pain, especially if imaging shows thickened or deformed bone. Thanks for joining me in this quick high-yield breakdown of Paget disease. Be sure to follow and hit the notification bell so you never miss an episode. And as always, this is the Pro PA podcast, where future pros in medicine are made. I'll catch you later.